If you look up the program book, this is the last printed talk in the last session of the conference. So what is the worst communication error that the last speaker can do? Is to talk too much and keep you away from a good, nice, well-deserved lunch. I'll try to be brief and talk about communication errors. So what is communication? The imparting or exchange of information by speaking, writing, or any other medium. Why do we do communication? Oh, slide's not visible. Another communication error. At every stage of the interaction with the patient, and it just does not have to be what is communicated at every stage in your clinic. That is one aspect of it, starting from the body language and the expression and the way of dealing with the patient, whether he's communicated to with respect and handled with all the courtesy that is needed, from the phone conversation to the reception to the workup by our optometrist to the clinician and the surgeon and to the counselor and by everybody else. That is just one aspect of it. But the ambience also plays a role, and the what you have put on your reception, what you put in your chamber, all that is good communication. So if you want the patient to understand a little more about cataract surgery, you need to have communication regarding all those aspects on display in your center, which will send positive vibes, which will build confidence in him and in the procedure that you are going to choose to do for him. So ये हुआ तो डायरेक्ट इससे फिर से एक बार ट्राई कर लें. पेन ड्राइव पे नहीं आया कह रहे हैं. So that is one aspect of it in the pre-operative communication, and what all you need to communicate in your pre-operative communication is to, one, assess what the patient wants, what his psychological makeup is, who's the decision maker in the family whom you need to communicate with, and make sure that his psychological needs are met. Then what is it that he is looking for? That is very important for you to assess, and of course communicate all the factual information that he needs to take his decision, and make sure that you make him feel that he has taken a decision, rather than the communication being such which leaves him feeling that something has been forced on him. So that is a very, very important aspect of communication in the pre-operative period. So a little extra time spent by your counselor and eventually by you in decision making. Very often the patient will come back and say that whether you're going to use a femto procedure or if you're going to use a trifocal lens, unless he has had a final word with you, he often doesn't want to take that final decision. So the signal by the counselor also needs to be very clear, and then the signal from you should also reflect your confidence in that procedure. In fact, that comes out of honesty. If you honestly feel that that is the best procedure for him, that's the most convincing way of conveying it to the patient. And I mean, in terms of analogy to oculoplastics, people ask me, how do my patients for unilateral ptosis get a bilateral sling done? Because I said, because I feel that that is the best that I can do for him, and that I'm able to communicate to him. So that is the similar analogy here. So the procedure that you're doing, if you honestly feel that you're doing the best for him, you will be able to communicate that to him. So that is about the pre-operative communication. The communication during the surgery also is important in various ways. I mean, one, the ambience of the operation theater, how you're communicating to the patient, informing him, talking to him, telling him that this procedure will cause a little discomfort, that he has to look at the light, but should not cause any pain. And if you have any pain, please do communicate to me. Don't move your hand up, and so on and so forth. If that has been communicated to him before, and intraoperatively you have a voice which is reassuring and calming, that will work well. If on the other hand you have a complication and it shows up with a louder voice or an anxious voice or a voice raised to talk to the technician to give an equipment, that all comes to the patient. Or to communicate even a simple thing, oh, ye power 0.5 idhar reh gayi, or something like that is spoken loudly, that is a very bad signal to the confidence of the patient in the entire setup and you. So those intraoperative signals are also important. And post-operatively, there are those aspects of a routine patient who may be very happy, and if he gets to see the surgeon, he'll be very happy and things generally go very smoothly. But there are those patients where communication is required in a more elaborate fashion, because those are the cases who may not have the kind of result that they wanted. And this may be because of an intraoperative difficulty, or this may be because of a just a mismatch between the expectation and the. So the chair time becomes, or was that a shortcut? So maybe we need to go to the, okay. So doesn't matter. If you can just put that directly, and if it works, that's okay. Otherwise, we'll just continue. So if that is so, then you have to make sure that the communication, that extra effort at communication is given. Of course, there will be those angry patients who are difficult to handle, and you have to have those mechanisms to tackle them also, and that they are handled by somebody who's good at psychology, who can make them sit, who can offer them a cup of tea and say that, okay, we'll be talking, we'll just talk to the doctor and make sure that he sees you, but cool him down before that happens, so that the patient goes back at least reasonably satisfied. Of course, there will still be patients who will go back unhappy. Kyun, Suhas? And there'll be some who will be very angry too at the end of it. But then some are inevitable, but you have to try and minimize those with your communication strategy. So from the beginning to the end, it has to be a well-oiled mechanism that you have to build, and your way of communication, your thought process, everything has to be geared in a way that the communication at all levels is maintained well and is appropriate. And it comes body. Yes. Yeah. So one, if you have that empathy to the patient, and one that you have the confidence in yourself, then that reflects. So that's where. So both these things are required, but in spite of the two, if there is some deficit along the chain, that becomes a weak link. So the entire chain has to become strong in communication, not just in delivery. Like we say, in infection, the weakest link, one single weak link makes the whole thing problematic. So you may have an endophthalmitis because there was one weak link in your entire chain of things that you do for the patient. So one weak link here could also mean an angry patient, somebody not responding well enough at the reception or at the TPA desk or something, and that will end up with a blast from the patient. So you have to make sure that that whole chain works well, which is not always easy. As Suhas will also testify, there will turn out to be weak links in the system, but you have to constantly be on the watch out, look out for signals. If more than one patient has spoken about employee, then you probably need to shift him from there or shift him further away from your clinic. So some of those things you really have to be watchful of. So communication is important as much as your surgical technique as much as your care to deliver the best for having a satisfied patient. I think that serves the purpose. There were some nice photographs or pictures or something which we'll show some other time.
We can see very few. You can just show on the laptop. We can see them.
If it works.
Laptop में सही.
People can come in for.
Yeah, exactly. We are very few.
You can come and see certain laptop. Actually, that's the essence of communication. If everything goes wrong, no logistics working, still the communication is so empowered and so impactful that everybody is sitting and trying to listen whatever he speaks. So the body language matters. His smile never went off. Everything happened. I lost my smile, but he never lost it. So that's the key, and that I think that comes with experience and age. So when people at apex speak, we as amateurs learn, and that is the ladder to the success. So whatever he has achieved, whatever stars he has,
Gray hair.
yeah. So these are signs of experience. So the way he smiled, the way whatever he wanted to convey, he conveyed, and we know what he wanted to say. So every word was important. We can recall, we can recapitulate, and then assimilate.
Just switch it on once, we'll see. Okay, it's perfect. Communication with computers is also important. नहीं blink कर रहा है. So, those of you